TMJ stands for temporomandibular joint, and some people will come in and say, I have a TMJ problem, and we term that as TMD, or temporomandibular joint dysfunction. People can come in with pain where they have difficulty opening, biting down, clicking or popping, different types of things that disrupt their normal everyday life. The patients who come to me, when we look to do things, we try to figure out the most conservative way to treat their problem and basically make it easier for them to be able to live their lives. People can have severe pain, they can have headaches, they can have neck pain, back pain, and interestingly enough, it can be related to their jaw. One of the things that we always look at in the practice is the mouth is connected to the rest of the body. And so we were seeing interesting things happen, that we would treat people for pain that they were having in their jaw, and they would come back and say, hey, this feels better or that feels better. Not that we ever thought that that would happen. And it was like, well, why is this going on? And I keep a record of all those different things. And reading and looking at different things, I was saying, are these things happening? My big question always is, well, why? Why is it happening? Why does it work? Why do some people get better, or why some people don't? And that made it interesting for me, because I can make a difference for somebody very rapidly to where they can actually function in a much better way than they've been able to. So from when I started learning about TMJ was basically when I was in dental school. It was limited. But then when I got out of school, I started taking courses year after year after year, meeting people who were top researchers and clinicians in the world and asking them questions. And I was fortunate because a lot of them answered the questions and gave me the opportunity to learn from them. And so things went on and on. I didn't just learn this last week. This is 30 years in the making for the knowledge that I've been able to acquire. So this was a young patient who came in, and she came in because she could barely open her mouth. She had trouble eating from a spoon. And we wanted to find out what was happening. So we did our tests in the office and determined that it was indeed a joint type of issue. And we sent her for an MRI. An MRI uses basically magnetic resonance imaging. There's no radiation. And it shows us what's happening with the soft tissue. It's the gold standard of finding out of what's happening with the joint. From that, we found out that she had dislocation without reduction. Basically means that the little hockey puck-sized disc that sits between the bone of her lower jaw and her skull was out of place and didn't go back into place. And what happened was her muscles were all contracting and everything was basically locked, so she could barely open her mouth. So for her, what we did once we found out where it went, we discussed what the options would be, and we took impressions of her mouth. We made a lower appliance, an orthotic, that she could wear, and basically gradually over time the muscles relaxed to the point where she was able to open probably 5 times the amount that she could open from where she started. And no pain, and over a period of 6 to 9 years, she was actually in much better shape, not having any issue, and just wearing the appliance at night. So when we see that there are joint issues, and there can be many types of problems, there can be things where the bone is resorbing, basically where the bone starts to disappear, and something bigger needs to go on, where people start to develop other problems, or we see changes that cannot be resolved with conservative treatment. And that's when we consult with a surgeon who would do different types. There are different types of TMJ surgery that would be available. It doesn't happen often, but when it does, you need somebody good to take care of it. I'll say this because it's the traditional model is moving towards medications. So, so one of the other treatment lines for joint issues is pain medication or other types of medications. I'm not a big fan of that because, again, I think we're treating a symptom at that point and not treating the actual issue. So it can be anything from a patient who comes in with existing pain, difficulty chewing, eating, speaking, swallowing, where they have a type of pain, to having their mouth get locked open or locked closed. Or often people come in for an initial exam. We're doing our routine checkup, and we always do a TMJ exam on our patients. And we may see that they have a limited range of motion, meaning they can't open their mouth as wide, they can't move side to side. And we'll have a discussion about, do you have any other issues? And patients may say, yeah, my mouth got locked a couple of times. I was in a car accident, I got hit with a bat or a ball or this or that. And so we write down those things because sometime in the future something else may come up. And if it does, then we've got the line where we will do our objective measuring, whether it's imaging using a cone beam CAT scan that we have in our office or doing an MRI.